Welcome to My Health, My Way, a podcast dedicated to empowering and supporting women living with endometriosis, adenomyosis, and infertility. We are your hosts. I'm Alana, Marketing Business Manager, and Sarah, a functional diagnostic nutrition practitioner. We are here to bring you stories and insights from a holistic perspective. Our aim is to foster a sense of community to help you navigate the challenges and triumphs that come with these conditions. Get ready to embark on a holistic adventure with us. Welcome to My Health, My Way, where health meets functional wisdom. Hi, Sarah.
Hi, Alana.
Good to be back. We've got a few more episodes here on the podcast, but today we are going to be specifically doing myth busting.
Yes.
Because so many women over either the course of, their life, from teenagers, from what you're told from your mother, your grandmother about different things, to then when you're a little bit older and you start investigating things yourself, and you might get told something about from one doctor, and then a friend will say, oh, I heard this, did you understand? And you're like, oh, does that really make sense? Is that true? So from somebody who is being told a whole lot of myths and from somebody who's believed a whole lot of myths, let's bust some.
Yeah, let's do it. Let's get into it.
So, myth one.
Yes.
Endometriosis only affects the pelvic region.
Well, we know that that's not true.
Right, yeah.
It absolutely, the lesions can really grow anywhere.
Yeah.
They have even been found in a woman's chest, brain, like anywhere.
Wow.
So it's not just confined to the pelvic area at all. Mm-hmm. So yeah, we can just, bust that myth straight away. It's not just confined to the pelvic.
And when we talk about endometriosis, and we're talking about the growth or the lining of the uterus outside the uterus,
it's not actually that's the thing. I think that's the other myth actually.
Yeah.
While we're getting into the myth, that's actually the other issue that keeps going around is that, and this is still being spread, and actually I think that's almost what sometimes keeps women stuck there, believing that it's this issue with the uterus only, like it's a period disease and it's a uterus disease, when in fact the tissue that is growing outside is not the same. It just acts the same or similar.
Okay.
We know that, but it's not the same.
Okay.
So I think that's another thing where the wording does matter a little bit in terms of changing the whole narrative that it's a period or uterus disease.
Yeah.
Because that's where the tissue is coming from. Yeah. Actually, no, it's not.
Yeah.
We don't actually know that.
Yeah.
So it's not the same.
And the reason we don't know that is because not a lot of studies have been done on it really at all.
Well, interesting enough, studies are now being done on men around.
Yeah.
That's great. Why are we doing that? Women are suffering. Hello. But there's actually some studies being done on men now with, looking into tissue growth, and I'm like, no, we still need to figure this out for the women. Can we just stay on? Yeah, but anyway.
Yeah. So let's do another myth. Endometriosis always creates infertility.
No.
Wow. Incorrect.
We need a sound.
Yes, exactly. You do need a sound.
Absolutely not true. Obviously, I'm a perfect example, and other, clients of mine are perfect examples of the fact that it doesn't necessarily always cause infertility. It can definitely contribute to the issue of why women are not falling pregnant. Mm-hmm. Now, and it really does depend too on where these lesions are growing.
Yeah.
So for me, and I'll just give you that example, actually when I came out of my surgery, my specialist back then told me that the majority of my endometriosis was on my right ovary.
Right.
And so it would make a lot of sense that that's probably why I wasn't falling pregnant.
Mm-hmm.
And so it matters, I guess, where these lesions are growing, but then also not to forget that it creates a very inflammatory environment.
Of course.
And the body doesn't favor conception in an inflammatory environment. And it also affects then the sperm. Mm-hmm. So this is where, I guess, decreasing inflammation comes in overall.
Yep.
But also this is why sometimes it can be helpful to have surgery, okay? To, remove the excess tissue see if it is growing somewhere around the ovaries that's kind of contributing to infertility. But then once that's been dealt with, this is where all of these other things, I guess, that I work on with the women come into place. Reducing inflammation, healing the gut, looking at, liver detox pathways, all of that, that's where that comes in.
Yeah.
Because that'll essentially help you reduce the inflammation, I guess, long term.
Yeah.
The surgery is a short-term solution because the problem with that is that if we're not addressing the actual overall inflammation that is there and all of the other contributing factors that increase inflammation in the body, the lesions will be back.
I was just going to say,
and then you have to, and this is why women have surgery because surgery alone is not what's going to decrease inflammation long term.
You're not getting to the root cause of it.
No, that is why surgery is only one tool that can be very, very helpful, especially when we're trying to conceive. But it's not a long-term solution. The long-term solution is to actually look into all of the contributing factors that are increasing inflammation in the body, healing those, and that will generally, put that to rest.
Right.
Yes.
Perfect. Now, this one is quite interesting, this myth, because this is what I actually dealt with as a teenager. So obviously when I first got my periods, mine were very heavy. Like we're talking when I was very young and very painful. And so my mother took me to the doctor and that doctor said, you could have endometriosis. Okay. Like, so at 12 and 13, that's what they were saying to my mother.
A long time ago that they were even aware of it.
Yes. So the myth is endometriosis pain only occurs during periods. And so that's what I think that myth fits my situation perfectly, is because that was the myth that was told to me, that because I was having such painful and horrible periods, is that, oh, well, you must have endometriosis. And so when they actually tested me for it, and I will say that they scared me at 13, 14, because they said to me, if I do have endometriosis, I'm going to have a very small period of time to be able to have children, if at all. Now, okay, without giving away my age, this was a long time ago, right? But obviously it wasn't the case. I didn't have it. It was, whatever. I was just a teenage girl coming into my time, and it settled down eventually. Yeah. But that myth was what was being perpetuated by the doctor, that, it is just happening around your period and that was it. So that is a complete myth.
Oh, yeah, it is. And look, while you say that, I guess you were told you must have it because of the pain around the period. I was told I couldn't have it because my pain basically wasn't, severe enough. My pain was actually worse around ovulation. And I think it makes perfect sense now that I know, where the severity of my endometriosis was. I always thought ovulation for me was excruciating. That's when my bloating was insane. Sometimes my period, before my period, was always horrendous. But once I had it, sometimes that almost felt like a release of some sort. It's there. It wasn't that I was still sick and unwell. Having my period, but it wasn't that the pain was almost like it was gone once things were flowing, but it was almost like I felt this stagnation like before and around ovulation that just, that was the worst for me. It's not, and some women are in pain 3 weeks out of a month. They're always in pain. And I will say that has to do with where the lesions are growing and the location of them, how much inflammation there is overall in the body and things like that. I mean, I always had back pain. Always. And so, that was, and the endometriosis, some of my lesions were kind of tucked behind some of the organs. So my surgeon really had to look for it. And so, and I had the adenomyosis as well. So that comes often with lower back pain. But it's not just
my memory about
adenomyosis.
That's it.
Yeah. So that is the lesions that are growing inside the uterus, the muscle layer, and the other lesions are outside.
Right. Yeah. Right. Now, another myth, and again, I've been told this one, is that severe period pain is normal for some women. You're just one of those ones that's just going to really struggle with it,
Pain is never, ever normal. I don't care what degree we're talking about here. Pain is never normal.
No. I think about it in today's society. We all have prescription medication to take. We, have heat packs. We do, natural remedies. But I think about the women, let's go way back.
our ancestors, caveman times, women in the 1600s, 1800s, where they had none of what we've got now. Period pain can't have been that painful for those women because it's not, because as you just said, it's not normal.
It's not normal. And I also think a lot of the things that we have today in our, I guess, food system and with all the toxins, it didn't even exist back then.
No, that's right.
So we weren't exposed to what we're exposed to today, which is a huge contributing factor of, why we are in more pain than ever.
Yes.
So, yeah. No, but it's never normal.
It's never normal.
I think the problem is that a lot of the female issues are being normalized so much.
Yeah.
So much.
Yeah.
And that's not, that in itself is not helping women.
Yeah.
That is just normalizing it and brushing it off.
Yeah.
And then, sending them back out the door because, I'm sorry, but you're just a female. And, it's like when after I had my son, the whole, the heavy bleeding, it was normalized for almost an entire year.
Yeah.
Because I had given birth.
Yeah. Yeah.
And that can just happen.
Yeah.
Just because they couldn't find anything wrong, it was then being normalized because they couldn't explain it.
Yeah.
No, it was never normal, and there was a reason for it, but they just couldn't figure it out.
Yeah. Well, and again, in my situation where I had very painful, heavy periods when I started as a teenager, and then as I got into my 20s, it got much better, and then I didn't have my children until I was in my early 30s.
Yeah.
I had 2 children back to back.
Yeah.
But after I had my second son, I then, my pain levels reverted back to when I was a teenager. Okay. And I also went back to my gynecologist who birthed my children, and I said, I feel like when I was back at being a teenager, it is that excruciating, it is that pain. I know the difference between afterbirth pains and things like that. It was almost to the point of afterbirth pains, and we're talking 6-7 months, a year down the track after having my second child. And he just said, that's normal. Yeah. It might settle down.
I think sometimes too, I guess being a male doctor, how would they, for a second, how would they know?
Yeah, that's true. Yeah.
So I feel like when I actually went to a female specialist, I felt more heard and seen because I guess, they would have a period themselves. So sometimes I think it helps to speak more to the female doctors than them. I'm not saying that there aren't male doctors out there that are amazing and very understanding.
Yeah.
And maybe some are even more understanding than some females. So I'm not saying that. True. Yeah. But for me, it definitely helped to see a female who then said, look, no, this is not normal.
Yeah.
Whereas for over a year, I was being told that my symptoms, they must just be normal because there's nothing wrong with you. We can't find anything.
Yeah. So another myth, endometriosis always shows up on ultrasounds.
Absolutely not.
No. Well, especially if you said your doctor had to go looking for things.
So this is, and it's actually interesting too because I was listening to an interview by an endometriosis specialist, excision specialist, and he was talking about how if you cannot pick it up on an ultrasound, it is almost laughable because it's fairly easy to pick it up on an ultrasound, and it just means that the person who's doing the ultrasound is not skilled enough. Now,
that's not good.
What was interesting then that he continued to explain the reason why it was easy is because you can just see if organs are moving around freely or if they are stuck together. And I'm like, what he's talking about is advanced stages of endometriosis when we're in stage 3 or 4, when organs are, sticking together, your bowels and uterus and things. I'm like, hold on. What he is missing is the fact that we want to know, if someone is in stage 1 or 2, we still want to be able to help them. What he's saying is, if that's not what's being seen on ultrasound, well, obviously then you don't have it. It's like, no, but even if you have stage 1 and 2, it might not be that visible. It doesn't mean that they don't have it. He's talking about the advanced stages, and that's easy to see. I'm like, yeah, I get that. Maybe it is. But there is so many women that have had so many ultrasounds, myself included. They were told there's nothing wrong.
So what will you in the different stages of endometriosis, let's say you're at stage 1, do you progress through the stages? Does it just continually get worse, or do women just stay in one stage?
Yes. It normally, if nothing else happens and we're not addressing the whole body, it will generally just progress and get worse.
So then going under that, you don't want to wait until you're
No.
in stage 3 or 4.
Which is what
you're
he
going to be
exactly right.
And especially if you're a woman trying to start a family, you don't want to wait until you're in stage 3 or 4 to be able to come up an ultrasound and go, okay, well, now I've got it. Because then you've got a lot of groundwork to try and get back to,
It's the same narrative, I guess, where I guess sometimes, look at blood tests, same thing. So many women are being told that, well, you're normal, there's nothing wrong. When in fact the issue with that is that we're just not picking things up before we're in disease stage.
Right.
So once we're in disease stage and things are a mass on a blood test, we're in trouble.
Yeah.
But no one's picking up anything before then because the ranges are too wide. So of course you're just going to be sent back out the door that everything is normal.
Yeah.
And you can be medicated when, there's lots of reds showing up.
Yeah.
What about the stages before we fall into the red?
Yeah.
There's no preventative care.
Yeah.
And so it's the same kind of issue there, and same with ultrasounds. Like if we can only pick it up when it's in the advanced stages, well, that means that women will continue to go undiagnosed for years and years and years and years, which is exactly what's happening right now.
Yeah.
And that's not good enough.
No.
So I don't agree that it will always be picked up on an ultrasound.
Yeah. No. Agreed.
Before we jump back into the second half of our show, I would like to share how you can work with Sarah. As a functional diagnostic nutrition practitioner, Sarah takes a holistic root cause approach to your well-being. Say goodbye to merely treating symptoms and hello to uncovering the root causes of your health challenges. Sarah utilizes cutting-edge functional testing to get to the heart of the matter and design a personalized plan just for you. Just remember, she's only a click away. You can connect with her on Instagram under NutriRoot_health for valuable insights, health tips, and a peek into the world of functional diagnostic nutrition. If you're more of an email person, drop her a message directly at sarah@nutriroothealth.com.au. That information will be in the show notes.
Don't miss out on this opportunity to work with me, your dedicated health detective.
Now let's dive back into the second half of our podcast. Stay tuned for more intriguing conversations.
Birth control. Pop you on birth control, it's going to cure your endometriosis.
I love how you just said cure.
Yeah.
Yeah, totally.
Yeah,
Yeah,
sure.
you just do that.
Yeah.
No. Obviously, that's another myth. The birth control pill actually does nothing, like literally nothing, to treat endometriosis the way that women are being told it does. I guess the birth control idea is that it's really just looking at it's a hormonal issue alone, and we're going to suppress the hormones, and that way we are, helping you.
Yeah.
The problem is the lesions are still growing.
Right. Okay. So.
Okay. They are not. Yes, while they're estrogen driven, they're not. The estrogen is in the causal factor. We know that. So that means that if estrogen is not the causal factor, well, the lesions will continue to grow.
Yeah.
And I think that bandaging the issue like that means that a lot of women end up worse once they get off the pill.
Yeah.
And not to forget all the side effects of the pill.
Yeah.
That we're not even talking about. It's not the answer.
Yeah. No, totally agree. Pregnancy will cure your endometriosis.
How many babies in does that work?
Yeah.
I wonder how many children do you have to have?
Yes. Yeah.
When that kicks in.
Yeah.
Because it don't work for me. I had my son and everything went downhill from there. So I don't know, pregnancy didn't seem to help me there.
No.
So I'm not quite sure how it's I understand that. I guess their idea, the reasoning behind that is because it stops your cycle for, the period. I mean, the period of, the pregnancy. But the problem is that most women will find themselves back, where they were, and sometimes even worse off if nothing else was addressed.
Yeah.
And we're just going to continue the cycle after.
Yeah.
So, it doesn't address anything. Pregnancy it might halt it. But, I mean, if you speak to enough women, you'll get a pretty good picture that that's not the case for them. There's women who are pregnant who will go through hell being pregnant with endometriosis. And we can't forget that. We're not all the same. For some women, yes, that might be the case, that they feel better when they're pregnant and they wish they could be pregnant all the time. I had 2 amazing pregnancies. I felt great during pregnancy. For me, it was always the after.
Yeah.
And so, I think we need to look at, every woman and take that into account rather than just talk about the one that told us she felt amazing throughout pregnancy. We'll talk to the one that didn't feel amazing throughout pregnancy.
Yeah.
Because we need to take that into account. We can't just tell women to just fall pregnant because that's going to help you. It doesn't.
I mean, pregnancy can bring on so many other things. I mean, I don't have endometriosis, and I had 2 extremely difficult pregnancies. Yes. So, I mean, you know, I don't think it's a blanket thing for everybody. I mean, yes, while your body is growing a human, it might not grow the lesions that are, you know, with endometriosis. But that is not a cure. That is not a sustainable option for endometriosis.
You probably just have to like keep being pregnant then.
Yeah.
But you know, who can do that? So
and you're right. How many children do you have to have for it to stop? You know, so no.
I don't think that's going to work. But yeah, I think it's actually quite sad that women are still being told this. I feel like there's just too many uneducated, clearly doctors out there that keep telling women that, because I mean, by now we know a lot. Yeah. A lot more than we knew, 10 years ago. I mean, when I was suffering, I never heard of it. Yeah. Now, I mean, maybe it's because I work in the space. Yeah. And I hear about it all the time. I work with women with endo. But I do feel like a lot of people now do tend to know about it, at least when you start the conversation. Yeah. When 10 years ago, that was not the case.
Yeah, that's right.
So there's a lot more known about it now than there was before.
Now, this one's fun for all of us in this age bracket.
Okay.
Menopause cures endometriosis.
No, it does not.
No, I couldn't think that it would. Yeah.
No, it does not. And I think for that, you need to speak to some women that not only have gone through menopause, but maybe even had a full hysterectomy and still have endometriosis. Right. Speak to those and then tell me, how does that cure endometriosis? The lesions will still grow, and sometimes they'll just grow in all the other places. And this is, I guess, what goes back to my point, is that you have to address the entire body. You have to address the whole body inflammation. And if you don't do that, the lesions will still grow. Because if you still have lesions, and I guess, what I talk about a lot about is the xenoestrogens, the chemical compounds and all of that in the body, they'll still continue to grow the lesions. That has nothing to do with your uterus. So
it kind of goes back to one of those very first myths that we talk about, is that endometriosis is only in the pelvic region. I mean, if you have a full hysterectomy and everything is removed, and then you still have the lesions growing, it is not just in the pelvic region. No, it is not just a menstruation issue. It can just be a female body issue.
But the reason it's being, I guess, painted as that, as a period disease, or something that's tied to the uterus, is because you've got to go and see your gynecologist to even go down that path. So it's been put in that area where you are only ever gonna get thrown the pill out or the surgery, because that is what they do. We need to understand what these practitioners, specialists, doctors are being trained at. So of course that is what they're going to suggest, because that's where their training is at.
And again, no real clinical trials on women have been done. So unfortunately, the doctors that are going through university and doing all of their training, it's still outdated information that they're being told, and then they regurgitate this outdated information verbatim to their clients and their patients, because there is just no other supported medical information. I mean, I really hope that changes, and I think it is changing. I think it is moving, even for myself, who's not in the industry, but obviously I do have quite a big knowledge base on it. Is that women are now going, hold on a minute, we need some testing, we need some trials, and that's why women are looking outside the medical field for answers, for options, for let's try something a little bit different, because that is not working for me. Yeah.
No, that's true.
And this one here, again, this goes back to what I was told as a teenager. Teens can't have endometriosis, where for me, I mean, that's what my doctor told me at 13, or what they told my mother at 13 or 14, or maybe she's got endometriosis because she's so ill.
Well, that's not true, obviously. You can have endometriosis in your teens, and I don't think age discriminates like that. You're older, you're younger, you can't have it. No, you can absolutely have it as a teen as well. So that is absolutely a myth. And I think, again, that just adds to the issue that it takes women so long to be diagnosed, that many teenagers are suffering, and they're just being told that's just normal part of life.
Yeah.
You know, you're starting to get your period. You got to get through these years of, you know, teenagehood, and it can't possibly be endometriosis. And the problem then is that I guess these teenagers aren't being supported properly because they're just being ignored and gaslit and being told that that's just normal. You're female and this is what you have to go through.
Yeah.
When in fact, that's not true.
Yeah.
You shouldn't have to suffer. You shouldn't be in pain.
And then again, I think around the whole teenage issue, you're then, you know, by your peers, if your girlfriends don't have the same pain levels that you've got, if the other girls are, you know, in your social groups, school, things like that, you're then ostracized because you've got to take a couple of days off per month. You're telling your parents, I don't feel well enough to get up and go to school because, I mean, you know what it's like to live with endometriosis. Yes. I know what it's like to have extremely painful periods, even as a teenager, to think you've got to get up, get to school, sit around, do your classes, you know, and then come home. You feel so sick. And it's even like, well, us that are not teenagers, you've got to get up, you've got to get children ready, you've got to go to work, and you've got to go through all this pain. It comes back to that myth of the pain is not normal. That is, that shouldn't be, you know, and that's probably even as myself as a teenager, I was able to recognize this is very painful. Even talking to my girlfriends when I was a young teenager, they weren't going through the same amount of pain that I was going through. I was extremely lucky that my mother worked in the medical field and I had access to lots of different doctors that maybe normal people wouldn't have. And I was able to go and see specialists being told, you could possibly have endometriosis at 13 or 14. And then it was, oh, well, no, you don't have it. That's just normal. Again, not correct. But I think it's also good for parents, you know, to know that if your daughter is going through this type of pain, this is not normal. No. Now, if you are a father and there is no mother in the picture, please know it's not normal. If it is a mother who didn't have that type of pain herself, going, oh, well, I didn't have it, so therefore she won't have it. Really make sure you listen to your teenager. I mean, you know, I'm a very big advocate for that. I was a youth worker in a previous life, so I'm like, if your teenager is telling you something, please listen to them.
Absolutely. Yeah. I do agree.
Yeah. All right. Okay, here we go. Another one. Endometriosis is just bad cramps.
Oh, yeah, totally. Endometriosis shows up so differently, A, for, you know, different people, and then B, it comes not just, you know, with the cramps and the pain, there is just so many more aspects of it. Like, there's all the digestive issues that are always, you know, mostly there. For over 90% of, you know, women with endometriosis have some kind of digestive distress. And are generally mostly just being told is IBS. And I can't stand this IBS diagnosis. They're like irritable bowel. Okay, so you're telling me I have irritable bowel. I already know that. I know, like, I can feel that. So you're telling me what I already know, but you're not telling me anything else. Like, it's not helpful. Like, it's this umbrella diagnosis that has never helped anyone in history. It's what is actually causing it, and then let's tackle that. That is what's going to be helpful. And so women are being told that IBS and endometriosis often show up together. Yeah, it's true. And we can always argue what came first, the chicken or the egg. If I actually look at the women that I work with, and even myself, the digestive distress, the IBS symptoms were often there long before endometriosis diagnosis. So that is quite interesting, actually. And then also, you know, it comes with the oftentimes the fatigue, you know, it can be debilitating. And, you know, brain fog, headaches, anything really. I mean, the symptoms are endless with endometriosis. So, and then again, we do need to also remind ourselves that not necessarily all of these symptoms are due to endometriosis. And then being able to differentiate, okay, which one's actually causing, you know, what, and what is linked to what. And then, so sometimes we can, you know, fall into this trap of going, everything's being caused by endometriosis, which makes us feel even more kind of hopeless as to think that we can't change it and we can't do anything about it. But when we actually kind of like lift the lid and do the functional testing, I guess, that I do with women in the Endo Thrive Tribe, is that we figure out, okay, these symptoms are actually way more related to the digestive distress.
Yeah.
These symptoms are way more related to the fact that you literally have no gut microbiome.
Yep.
These symptoms are way more related to the fact that you have liver congestion and you have, you know, or you may even have certain genes present that,
Yep.
you know, affect your liver detox cycle. So there's all of these different things that actually can be addressed, but we've got to kind of like lift that lid and really look underneath.
Yep.
And we figure out, hold on, these are not necessarily symptoms that are being caused by, you know, someone having endometriosis. They are more linked to, I guess, the gut dysfunction, the liver dysfunction, you know, there's women who have, you know, chronic constipation. They can't even, like, you know, get rid of their waste. So now we have this increase in inflammation that is going to contribute to the endometriosis. So there's so many things that make endometriosis worse. So much worse. And unless we get on top of those, that's why I always call of these like contributing factors. So you've got all of these different contributing factors that feed into making endometriosis, I guess, excruciating. But can we make it not so excruciating? Yes, when we address all of these different contributing factors.
So you can't just pigeonhole it. You can't just say, well, this is this. You have to look at everything. You know, you have to really look. And again, my own personal issues, I was then told by a gastroenterologist.
You have IBS.
I have IBS. So,
I couldn't have guessed that one.
As a teenager, look, again, I was very lucky. I had a mother who was very on top of things. I had a gastroscopy, which is camera down the throat. They could not find anything on the diagnosis. IBS, that's what I had. And now I was diagnosed that at 15. I'm now 40. And I still go, I've got IBS. I say it to you all the time. Oh, well, can I take that supplement? I've got IBS. And you're like, well, hold on a minute. That supplement is for IBS. What are you talking about? You know, women with it go, I can't eat that. I've got IBS. Or, you know, so it really needs to, but I don't have endometriosis. So you, like, one doesn't go with the other. One is not pigeonholed with the other. Just because you have this doesn't mean you have this. You have to look at the entire picture.
And that's a wrap for Myth Busting Part 1. We will bust some more myths in Part 2, Episode 7 coming up, so stay tuned for that.
And that's a wrap for today's episode. We hope you enjoyed the enlightening discussions and insights. If you're ready to take charge of your health journey and unravel the mysteries of endometriosis, adenomyosis and infertility, don't forget to connect with Sarah on Instagram at nutriroot_health or shoot her an email at sarah@nutriroot.health.com.au. That will be in the show notes as well.
Remember, your health is an ongoing journey, and I'm your detective, ready to help you crack the case. Stay tuned for more exciting episodes, and until the next time, take care of yourselves.